going to give Pixel some Subcutaneous Fluids. First, I'm going to wrap her up in a burrito. So you take a towel diagonally placed and stand her kind of diagonally. Pass one corner over the nose and pick up the two sides. And you have your helper kind of maintain the front. You pick up the skin and make a tent with the skin, and then you pass the needle under the skin but not into the muscle. You open up your line. It can go full open. Make sure all your clamps are open. And then you start passing the fluid underneath the skin. On a rabbit this high, I would use an 18 gauge. On a smaller rabbit, I would go with a 20. But the smaller you go, the harder it is to get the fluid in. When a gut slows down or stops, the material dries out. The material in the stomach and the gut dries out, and this helps not only hydrate the animal but hydrate the food to pass. GI stasis, shock, circulatory collapse, bladder stones or bladder sludge. They'll also do it if there's a renal failure. She's gotten her fluid, so I've clamped off. You want to pinch where the needle goes into the skin and hold it as you withdraw. And hold it for a moment just to make sure that minimal amount of fluids leak out of the hole that you've made with the needle. You would do it at home under a doctor's direction, and your doctor will tell you what to do and how often to do it, and usually they will direct you as to if you see this at home, it's okay to do fluids, and under these circumstances you can do it at home, and under these circumstances do not do it at home. Get your rabbit to an emergency clinic or your regular doctor. You always want to use a new needle. You want to replace the needle that you used and dispose of the other needle because the needle has gone into the skin, therefore is contaminated, and contamination can travel up the line and contaminate what's in the line and what's in the bag. So you want to replace the needle immediately after giving fluids. That could be, and usually is, just a skin capillary. You can apply pressure, either pinching the insertion site or put pressure directly down on the site, and that usually will stop shortly after. The fluids won't flow, but when you're inserting, once you get through the skin, the needle should move relatively easily. If the needle does not move easily, then you've hit something, and you need to back out and try again.